Hello and welcome to Well Aware with Michigan Medicine. I'm Dr. Preeti Malani. I'm the University of Michigan's Chief Health Officer and a professor of internal medicine in the Division of Infectious Diseases. I'm happy to be back again today to moderate this webinar where we'll take questions and discuss how to reset your health amid the stress of the pandemic and changes at work and home, as well as how to support the children and older adults in your life. One area of focus will be how to find joy and peace during this holiday season and beyond. We will address questions submitted in advance, as well as questions that you may have during this live event. To submit a live question at any time, please use the Q&A feature at the bottom of your screen. We'll do our best to get to as many of the questions as possible. And now I'd like to introduce you to our outstanding and very knowledgeable panelists. Joining us today is Dr. Emily Bilick, who is an assistant professor of psychiatry, Dr. Srijan Sen, who is the Francis and Kenneth Eisenberg Professor of Depression and Neurosciences and director of the Eisenberg Family Depression Center, and finally, Dr. Carolyn Vitale, who's a professor of internal medicine in the Division of Geriatric and Palliative Medicine. At this time, I'd like to give our panelists the opportunity to tell you about their professional specialties. And before we launch into the question and answer session, I'll start with myself. I'm an infectious disease physician who's also trained in geriatric medicine. A lot of my efforts the past 2 years have focused on the pandemic, managing COVID, especially on our campus. And I also direct the University of Michigan's National Poll on Healthy Aging, which is a national survey of older adults on all aspects of health and well-being. And now I'd like to welcome Dr. Emily Bilick.
Hi, I'm a board certified clinical psychologist. I work in the child and adolescent ambulatory clinic within the Department of Psychiatry, and I'm the lead psychologist for the child and OCD and anxiety disorders program here. Within this program, I provide direct patient care, I provide supervision and training, and I'm involved with clinical research designed to better understand the treatments we have and how we can improve them. I'm also a clinical supervisor for the Trails to Wellness program, which is dedicated to improving quality youth mental health healthcare access in schools. I'm really happy to be here today. I'm just sorry because I forgot to wear my ugly holiday sweater. So sorry about that. And now I will pass it over to my colleague, Dr. Sen.
Thanks, Emily. I'm Srijan Sen. I'm a psychiatrist and neuroscientist here at Michigan. I'm a researcher, and a lot of my research focuses on stress and how stress gets under the skin and affects us and our risk for depression. Much of my work builds on looks at stress and depression among physicians and training physicians, and then uses that as a model to try to understand the biology of stress response and depression more broadly. As Dr. Malani mentioned, I'm also the director of the Eisenberg Family Depression Center. And as you all know and have experienced, that depression has been increasing in prevalence and impact over actually the last 2 decades, but has exploded in the last 2 years with the pandemic. And the center is really focused on trying to understand that and make changes and bring together the brilliant and passionate people we have across U of M and nationally to try to come up with new clinical and research innovations to help us reverse that trend and get better and help all of us, all of our wellness and depression. And the center wouldn't have been possible without the support of the community and some of you on the webinar today. So thank you for the support, and I'm looking forward to the panel. I'll pass it on to Dr. Vitale. Thanks.
Hi, everyone. I'm so excited to be a part of this panel today. My name is Caroline Vitale. I am a faculty member as Dr. Malani said, in the Division of Geriatrics and Palliative Medicine. I have a lifelong passion for caring for older adults in geriatrics. I am involved in leading our geriatric medicine fellowship program and trying to train the next generation of physicians to care for older adults, no matter what specialty they choose. I just want to put a word in for the word geriatrics. Sometimes that's looked upon as maybe having some negative connotations or depressing potentially by others who may have not seen the light of geriatrics, like myself and others. We focus in this specialty in really trying to optimize one's quality of life, meet them where they are, so to speak, to optimize all aspects of one's functioning or functional status. We pay a lot of attention to one's function in many different areas, in their abilities to care for themselves, to manage on their own, trying to maintain one's healthy lifestyle in order to prevent problems down the line. It's a big part of what we do. We assess cognition or problems with memory. And we really try to come up with ways that support people as they age in a positive way. I would say, again, geriatrics has that connotation. Sometimes the word elderly can have that kind of connotation. There's a lot of research being done about ageism in society, and we're all about optimizing the positive without denying that there's a lot of complexities and chronic illness that can occur as one ages. And we really try to take a holistic approach in how we care for patients. And one of the mnemonics that I think is very useful that describes what we do is embedded in the Age-Friendly Health Systems Initiative that includes the 4 M's. And the 4 M's are things that we think about: one's mobility, the role of medications in their care, mentation or cognition, which includes memory as well as mood, and then what matters to the patient. And that's really huge. What matters is taking into account patients' preferences and trying to frame their care around what values and what matters to them. So I'll stop there.
Thank you all for coming today. One of the things I love about this group of people, they're all wonderful people, but they also focus on the age spectrum, and everywhere from young children and school children to college age, young adults, physicians in training, physicians in practice, to the people who are of advanced age, older adults, and everything in between. So I think we're going to have a great discussion. We're really fortunate to have these individuals with us today to provide their opinions and advice on a range of issues around finding joy and peace amongst, especially this holiday season. And we are, I did want to say something, we are still receiving a lot of questions around COVID. I know it's very much on people's minds, and several of the well-awares have focused on this. And in fact, the October well-aware centered around COVID questions and answers with experts from Michigan Medicine, and that recording can be found on our website as a resource. And also, as you know, our presenters cannot give direct patient recommendations, but can give some general advice. So, with that, I think I'm going to go ahead and get started here. And these are questions that have come through from all of you. So, and again, we're looking forward to more questions coming on. So, first question, and I'm going to actually give this one to Dr. Bilick to start, and then probably ask the other panelists to chime in. It's hard to reconcile the uncertainty of the pandemic and urgency of health recommendations with the wear and tear they take on my mental health. How can I prioritize these? Do you have any recommendations as we near the 2-year mark of COVID? Dr. Bilick?
Yeah, I mean, I have to start by saying it's just so normal to feel that way. And I'd be lying if I didn't say that I experience a lot of that too. We've been just receiving so many mixed and often directly conflicting and competing messages about how to manage health and mental health over the past 20 odd months. And depending on the source, I even hear, stay home, the world is dangerous, and then everything is fine, we need to get back to normal. I might hear that same message in the same day. And the bad news is I'm not sure that message is going to change in the near future. Maybe one of you has a crystal ball and can tell me differently, but I'm not sure. So it can be very tempting to just pick an extreme and stick with it. Human brains love rules. It's easier to just follow a rule than be flexible, constantly adjust or follow nuance, right? And yet, I think my advice is to try anyway. Your health matters and your mental health matters. It is important to try to find a way to prioritize them both. No one can answer for you exactly how to do that, what that will look for any individual, how that will look for any individual, right? But I think of it as a bit of a pendulum. If you are only prioritizing your physical health, if you're way over here, you're probably neglecting, in this current environment, you're probably neglecting your mental health in some way. You may need to think about some ways that you can take steps out of your comfort zone to move maybe more towards the middle. If you have been more on the opposite end of that pendulum, maybe you're just feeling so over COVID, I might encourage you too to find a more nuanced middle approach. At this point in the pandemic, we have so many more ways to detect and prevent illness than we did even a year ago. There are ways to integrate health and mental health without too much burden. I will say this, in my mind, it's not about achieving perfection, whichever way you like in a given day, if you find yourself out of balance, maybe your priorities feel out of line, you're stuck a little bit more in that health side of the pendulum or the mental health again, you can take stock and shift. I think it's really hard. I just want to validate it again. I found myself in one side of the pendulum or the other, and I'm working on it too. And then the last thing I'll say is one concrete piece of advice that I can give that I also need to take myself is to eliminate or at least really reduce reliance on consuming a ton of social media, because that is probably where those sources of information that are unhelpful will pull you away from that healthy consumption of mental health messages.
That's a great bit of advice. I would agree fully. And Dr. Sen, anything to add to Dr. Billick's comments?
Yeah, I think those are really useful points. I might extend the social media to the news and that there's prioritizing. There's probably some information that we need to get and as we make our decisions, but there's also a lot of information coming at us that is just causing extra stress and anxiety and worries about things happening halfway around the world. And especially if you find yourself affected by that, then trying to limit your exposure and if it's affecting your sleep, then having the period in the evening before going to sleep that you're not watching the news or scrolling on Twitter and maybe doing things that are more restful and striking that balance between making sure we have the information we need, but not letting it overwhelm our lives.
And Dr. Vitale, anything specific to add, maybe in especially the pandemic has been uniquely difficult for older adults and for families and caregivers?
Just a couple of things that come to mind, just to try to add on to what my colleagues are saying there. One little anecdote is I think it is the New York Times who always tries to have one section of positive news. If I'm thinking of the right publication I'm looking at, but trying to balance what you're reading. And if they do have a section that here's what's positive today, maybe to take one of those stories and just balance it out a little bit. And then just trying to find, simple ways to try to work in some healthy distractions into one's life, whether it be reading, things that you enjoy, time away from the screens. But it's difficult. I know a lot of my patients are very distressed by what they're seeing on the news.
Yeah, thank you. I often say COVID is not the only risk to our health. I say it like at least once a day. So I feel like this isn't going to be about COVID, but I wanted to say that. And, with that in mind, I think, even simple things like removing the apps from your phone can be really helpful. And, speaking of COVID not being the only risk to your health, Dr. Vitale, we got a question about older adults. Mm-hmm. And how do you encourage older adults to get up and move about for exercise? And it's been interesting. And some of the work we did with the National Poll on Healthy Aging a few months ago really looked at the risk of falls because, some people aren't doing their usual activity. So
Right.
And we're getting into, at least in Michigan, where it's icy outside and slippery. What's your advice on this?
So several, I think, and I have to second that, Dr. Milani. I've seen this within my own family members where they're not moving around as much. Some of my retired, relatives who have sustained falls, and just because I feel like it's because of deconditioning. So if you don't use it, you lose it, is kind of what we like to say. But a lot of routines have been disrupted for our older adults. I've had many patients who normally would go to the gym and walk on the track regularly. And so it's just trying to rethink about how we can incorporate this back into our routine, whether it be maybe going and into a larger space, perhaps the mall, and developing a walking group at the mall. I think there's a social piece to this as well, where if we can find ways to exercise safely, perhaps meet somebody either at the mall or again, perhaps in a gym that is pretty, ventilated, we think, and safe with masks on. We know how to be safe in these areas. Or trying to head outdoors if you're visiting, if you have grandchildren that are visiting, and trying to go for walks outdoors. But fitting it into your daily routine is the key. Many routines are disrupted, and even if it's 10 minutes a day, and trying to track your activity over time, and then maybe building in some rewards for yourself. Perhaps buying that book that you wanted to read as a reward for a week's long worth of exercise that you're trying to keep on, track of. So.
Yeah, that's great advice. I know within my own family, my in-laws were really anxious to get back to the gym. And this has been like a discussion over the last few months. And, in the end, I said, their risk of, they're fully vaccinated, now they're boosted. I said, there's a risk of them not going. And so I, asked them to go like kind of at off hours and to wear a mask there and try to, if it looks crowded, come back home.
Exactly.
So I think, again, you're not going to eliminate your risk of exposure, but everything's a trade-off. So I really appreciate those comments. This next question is, it's a little bit like the first one, but I'm gonna read it here. How do I get back to life? I was a very social person and I'm scared to go out. There's so many people who do not wear a mask. I've had my 2 vaccines and my booster and I'm still afraid. Dr. Sun, can I have you weigh in on that one?
Sure. Yeah, I think similar to I think you said it well for the last question. I think it's great that you have your vaccines and your booster, and that probably allows you more room in those kinds of interactions. I think we all have our own balance and where the set point is, and you don't want to do activities that are increasing your stress or anxiety, but I think if you've been vaccinated and boosted, that figuring that out, where you're comfortable, which people you're comfortable with, but really once that's done, then prioritizing that those social aspects for many of us, and it sounds like for you is critical for all aspects of our health, and we saw that in the early parts of the pandemic. So figuring out what you're comfortable with and what you feel safe with, but then being intentional about spending time with the people that are good for you and good for your mental health, and supporting them is really important. And the more you can do it while still feeling safe, the better.
Yeah, and I will emphasize that we should feel good about being vaccinated and boosted. I think there's a lot of attention, and again, I'm trying hard to not let this become well aware about COVID. We promised that it wouldn't be, but I think this question's come up, and there are some unknowns, and it is frustrating because the knowledge changes, and it feels like maybe the vaccines are not as helpful, but illness and infection are 2 different things, and even if you get infected, the vaccines prevent against illness. And again, the kind of context where people really are getting exposed is not necessarily being out in a casual setting, and certainly being outside. So I agree with that. Feel good about your vaccines and do find ways that are comfortable to get out and about. This next one I'm going to give to Dr. Bilick, who she has a lot of expertise in anxiety, particularly with younger people, children and adolescents. My son suffers from severe anxiety. How can I help him? What treatment protocols have been working? He has grappled with this since he was a child, and he's now a young adult.
Yeah, that's a great question. There are treatments that work for anxiety. So, and I'll talk specifically about psychotherapy, and I'll let my physician friends talk about, medications if they want to. But cognitive behavior therapy is the treatment of choice for youth anxiety and for adult anxiety as well. So if your son and anyone else on the call has not tried cognitive behavior therapy, or colloquially it is known as CBT, for anxiety, that might be something to look into. And I'm really sorry that he's struggling and has struggled for so long. That's just really hard to watch someone that you love be in pain and to struggle with something that can be as debilitating as anxiety. So CBT, what does that mean? Basically, what we look at with CBT, it is cognitive behavior therapy. It is really helping people learn new strategies to deal with fear, with anxiety, with triggers of the things that bother them. So oftentimes that will incorporate skills like cognitive restructuring. Again, that's a lot of jargon, but when I have a thought about something that scares me or worries me, so if it's a young child, it might be my mom will not come pick me up after school, right? Or maybe mom is late to pick me up after school because she has gotten into an accident and something horrible has happened, right? Cognitive restructuring helps kids or anyone learn ways of looking at their thoughts and identifying more helpful ways to relate to that thought, right? Okay, so what might be a more helpful way to look at that thought? Is it the most likely outcome that she is late because she's gotten into an accident and died? Possibly not the most likely thing. Is it really helpful for me every time mom is 2 minutes late for me to be perseverating on this outcome that she has got into an accident and most likely died? We don't always focus in CBT on whether it's rational, right? That's one way, but we also focus on, is this helpful? Is it kind to myself to think this every time? So someone with social anxiety might have the thought, everybody hates me. I can't go to the party because no one will like me there. Is that a really helpful or kind thought? So cognitive restructuring is a skill that happens in CBT. Another big skill that your son or someone else might learn in CBT is exposure. And this is something else I was thinking about when Dr. Sen was answering the last question, which is, it would be wild if after 2 years of getting the message that it is dangerous to go out, that even if you've gotten 2 vaccines and a booster, you suddenly feel safe going out. It makes sense that you feel afraid, right? We would all, I don't know if everyone feels afraid. I understand if you feel afraid, right? Sometimes in order to not feel afraid, you have to do it afraid, right? So sometimes the fear doesn't go away until we do it afraid for a while. And that's what exposure is in CBT. So if your son is dealing with crippling anxiety, for a while, you might during CBT, they might be doing something called exposure with the guidance of a therapist who is very well trained. They can help them in a systematic way face their fears. So they learn that their fear is not dangerous. Just like, now I'm vaccinated, I have a booster, I can go out into the world and systematically face my fear and be okay. So that was a long answer to your question, but I think CBT could help.
Thank you. And I like that notion of sometimes we have to do things afraid. And again, easier for some people than others, but it's probably good advice really for all of us as we're thinking about this holiday season being different, hopefully for most than last. And I'm just going to put in a quick plug. I had an opportunity to do a quick interview with Dr. Billick around anxiety, and that we'll send the link out. This was with the Michigan Answers podcast, and I thought it was very, very interesting to me. I learned a lot from her. I'm going to shift now to older adults. And Dr. Vitale, this is a question that came in. How do we help our young grandchildren understand our long absence from their lives and the new social norms required by COVID and social distancing, especially when prior to this, I saw them every day. I mean, this is, the distance between grandparents and grandkids is one of many, many tragedies of the pandemic.
Yeah.
And I'm sure this has come up a lot in your discussions.
Yeah, I know everybody's individual situations are different. I do think, like I said, routines have changed to such a degree. One thing I think that I've seen work pretty well is to have a regularly scheduled Zoom call or video chat with the kids, but with the grandkids on the other end, to help that connection stay there. And it's hard to explain why, I guess, to the grandchildren. I'm just seeing it from the older adults' perspective, but it's so important for our older adults' well-being to maintain that special connection with their grandchildren. This is a huge source of positive quality of life aspects to our older adults, is the relationship often that they have with their grandchildren. So I do draw from those who have grandchildren that normally live across the country and where they may have put this in place anyway, even prior to COVID, where they have regularly, every Sunday morning have a Zoom call or have some sort of FaceTime call with their grandchildren. I guess that's one solution. Probably not evidence-based, but one solution. In terms of explaining, I think it's hard to come up with a great explanation from my perspective. I would draw upon my colleagues as well to see if from the child's understanding, I think our older adults worry about the damage being done potentially between that relationship. The other thing I think of is, can we think about going back to the days of being pen pals and just writing and sending, and we all love to get things in the mail that are special, and that can be done, I think, in this situation as well.
Yeah, there's, we don't need evidence-based research to know that nobody loves people. No one loves you like your grandparents. And those of us who have had the benefit of a grandparent's love in our life are better for it. And it might not even be your actual grandparents. It's just older adults in your life. We all benefit from that. And I think this actually may be one of the useful things in social media that people do feel tied in. So, thank you for that. And I also think that kids are pretty resilient, and that, although some of the really little ones, they don't remember life without COVID. I also think that they can adapt back, and maybe better than a lot of adults. So, find ways to stay connected, I guess, is good advice. Mm-hmm. I'm gonna shift gears a little bit here. Dr. Sen, this is a question that came in. I'd like to have someone address how to turn down the racing brain to go to sleep.
Yeah, that's a great question. I think, well, first of all, it's really important, and the most important first step is understanding that you have that racing brain that's affecting your sleep, and then with that, there's a lot of tools that can help. Dr. Bilick gave a really beautiful description of CBT, and CBT is incredibly effective for insomnia, both in a formal way and getting formal CBT therapy. There's also now a lot of apps or even discussion about how you can work with those racing thoughts and challenge negative thoughts that are keeping you awake. At the Depression Center, we have a toolkit listing a lot of these apps and approaches, and we'll throw that information in the chat for you to check out. I think beyond that, specifically CBT, there's a lot of behavioral and sort of setting up our lives to be healthier for sleep. Like we talked about a little bit earlier, making sure you're not exposing yourself to really stressful materials and probably even light from the computer and TV right before going to bed. So giving yourself a wind down period for both in terms of light and in terms of the material and the types of things you're consuming. setting a regular bedtime and wake time and sticking to that as much as possible, and having where you sleep be as quiet and free of light as possible. Relatively mundane things, but it's amazing how well those work in helping to improve our sleep. And we've seen all along, but particularly down during the pandemic, how important sleep and regular sleep is to our mental health and well-being. So it's great that you're thinking about it and prioritizing it, and hopefully some of those tools and tips can help.
Dr. Vitale, sleep issues are a very common complaint among older adults. Is there anything else that you want to add? I'm sure that that's something that on a daily basis you get.
Absolutely. We talk about different ways that Dr. Sen talked about in terms of limiting what you're reading before you go to bed, in terms of, the news and things like that, wanting to have a relaxing routine before you're going to bed, if at all possible. And I think exercise should play a role here too. Exercising on a regular basis during the daytime, probably not too close to when you're trying to get to bed, but having that exercise during the day has positive effects on someone's sleep as well. And so this is a very common problem. Again, the CBT is something that we often will utilize for our older adults as well. It's very helpful to learn about sleep, learn about different habits that can be helpful. And those programs are now also available on apps that I think have been very helpful as well.
Thank you so much. The tragedy in our community at Oxford High School is very, very much on many of our minds and in our hearts. And we're getting some questions on those issues. And Dr. Billick, can you please address the recent school shooting and some of the ways that you're thinking about this? And I know you work a lot among this age group.
Yes, of course. So I just want to first say, to all the families, loved ones, community of the victims, and anyone who's directly impacted by the shooting last week, of course, I'm so sorry. And anyone who has seen the video coverage or who has dealt with threats in their school or their children's school who is scared, and I'm so sorry. Schools are a place to learn, and all children deserve to be safe. I'm a parent of young children, and I feel a little less safe this week, and I feel a little more raw. So if you feel that way too, that is totally normal. It's also totally normal if that's not how you're feeling. So I want to expand this discussion now to children and their experience, reactions to traumatic events. They are often varied, and there's a very large bucket of what can be normal. If you have kids who were impacted by the shooting and who may be behaving or reacting differently or not, and you're wondering if that's normal, my answer is probably yes. Common reactions to trauma, they might include emotional responses such as fear or sadness, guilt or anger, or using humor to cope. I've had patients tell me about that and then feeling guilty about that. And my reaction is, no, absolutely. That makes so much sense, right? And that is totally normal. And you are fine, right? You are good and you are okay. You might also see kids having difficulty concentrating or having nightmares, crying, withdrawing, maybe being more irritable, having conflict. They may respond by having physical complaints, body aches, stomach aches, headaches, all of the different types of physiological reactions, nausea, heartbeat, tension, those things. Or you may notice nothing. All of those things as a parent, a caregiver, a loved one, a teacher, whatever your role may be, they may concern you. My guidance to you is that it's okay, right? That doesn't mean you should do nothing. In this short-term aftermath, what can you do? You could provide comfort, support. They may be feeling unsafe. It would be natural to feel unsafe. Make space to talk about it, but maybe don't make them talk about it, right? Know that they can't, allow the child to know that they can talk about it without requiring it. I am guilty of using a lot of therapist speech. So I'm always saying things to my poor children, like, it's okay to feel that way. It makes sense that you feel that way. So you may want to use your own words there, but validate their emotions. It is okay to feel that way. And I don't know another way to say it. I'm sorry. Like I said, if they don't want to talk about it, that's okay too, but try to find a way for them to know that they could come to you to talk about it. You might say something, it's also good to model. So you might say something like, it's been hard for me these past few days since the shooting. I've been feeling really sad and a little worried. That way they know that that range of feelings is okay and that they could come talk to you. And I think the other thing that they know is that you're not afraid to talk about it. So I really want to emphasize that you should not feel afraid to bring it up. Your child knows about it, right? Unless they're very, very young, they know about it and they are thinking about it. This, like I said, goes for younger kids too. And I think in general, kids become more afraid when we don't talk about the difficult or scary things that they are aware of, that they've heard about. If we can talk about it and address and answer their questions in age-appropriate ways, we are able to dispel myths and misconceptions that are just running rampant in their heads. And when we don't talk about it, it's understandable. I understand why we don't bring it up. I feel those same hesitancies, that anxious avoidance feeling when I don't want to bring up a hard topic with my kids. But if we don't talk about it, you're not re-traumatizing them by asking if they want to talk about it. Instead, giving them the chance to, again, know about, like, having a family discussion and answering questions and addressing those misconceptions or fears. I just have one more thing I want to say. I'm so sorry. If they are having some of these things that I'm talking about, that does not mean that they're going to go on to have a traumatic response. That doesn't mean that they have PTSD. If in a few weeks they are still struggling, then that might be a time when you would want to reach out for a referral. But for now, I just want to say most kids are resilient and will not go on to struggle.
Thank you so much for those tips. I know families are trying to have those conversations, so that's very helpful. Dr. Sen, there have been multiple questions about stressors and depression, and this is where a lot of your interests in your academic work have been. People have asked about work, school, life balance. Right now, one of the big things, particularly not just at the health system, but really everywhere, is staff shortages have added to work stress. Can you share some thoughts about those type of stressors, work, school, life balance stressors?
Yeah, and they've really been a problem for a long time, but another thing that's been sort of magnified by the pandemic. I think sort of like Emily was saying, having grace with yourself and with others is really important, and realizing that we probably don't have time or the bandwidth to be perfect at everything in all aspects of our lives, and trying to figure out what's really important and vital to do well, both in work and home and other circles of our lives, and prioritizing that, and then letting other things go. I think one of the stress and how stress affects us is really a huge area, and stress affects each of us in different ways. But I think one of the points that could be helpful is that our stress response system evolved mostly to deal with acute stressors, like a lion sneaking up on us, and once we have that in a chronic way and it's activated over and over again, what's initially an adaptive and a positive response can turn negative, and I think we've seen that among healthcare workers. We actually saw in the pandemic in April and May of last year, depression was way down and people were felt more meaning in their work. Healthcare workers were hailed as heroes, but they were working really long hours, but that was not sustainable for beyond a few weeks. And as the pandemic has rolled on, that's reversed, and well-being is down, depression is up. And I think there's an element of that happening to all of us broadly, that what was sustainable for a few weeks is not going on 2 years. And so really setting up our lives to be sustainable, and how our work and home lives interact in ways that are sustainable is important, because it doesn't seem we'll be dealing with this for longer, and hopefully a lot of the lessons we learn here will be applicable even when we're through the pandemic. So so I think, prioritizing what's important and letting the other things go would be my primary advice.
Yeah, that's good advice, certainly for now, and really for always. Dr. Vitale, we've gotten some questions around grief and loss. And, I think in so many ways, the last 2 years have been a time of grief and loss. And, perhaps you can comment on this. Do you have any advice on how to deal with grief and loss, particularly during the holiday season?
Sure. So grief, our older adults are often on a more regular basis dealing with losses of those, just by virtue of living longer, normalizing a bit. And again, my colleagues can also comment too, normalizing a bit of what happens when we lose a loved one is important. And just also knowing that there are resources out there for grief and loss to be able to tap into, especially if you've lost a family member, lost a spouse. I've had family members who've really gotten a lot out of the actual grief counseling that our hospices engage in. And that's a really important resource to understand that that's available, even if your loved one has not utilized the hospice resources out there. And if I can try to find some resources on that if needed. I think anytime we have an anniversary of a death of a loved one, that is a time that is an important thing to recognize for others, to maybe reach out to that person. They may need extra support or recognition that this anniversary has come about, and that can be particularly difficult. And I think just acknowledging making it normal that that these feelings of sadness or grief are real, but having the supports around you, whether it's your church community or religious community around you, your close friends, or those that you might see at a senior center if you're venturing out again. But I think it's important to be able to understand that this is normal, but that our social connectedness is so important, and to try to navigate that through, again, COVID has been challenging for our older adults. So, trying to find also what's meaningful and to engage in those activities, I think can help with the overall stress of the pandemic. And there's a lot of research right now being done into understanding the importance of engaging in meaningful activities. So thinking about what is fulfilling to you, what is fulfilling to your soul, whether it be, reading or certain musical activities, or spending time with family members again, or your spiritual engagement, trying to intentionally engage in these things through the pandemic. So.
Yeah, thank you. And I'm going to make a plug for the grief counseling. I have a close colleague who had a very catastrophic loss in recent weeks. And I spoke to her a couple of days ago, and she said, it's helped me find the words to describe what I'm feeling. And she's like, I'm not ready to move on to this yet, but I have the words now. And I thought that was really powerful.
Yeah.
And everyone's journey is, of course, a little bit different. So, sometimes, and there's some good books out there too. That sounds, kind of trite, but it actually can be helpful for people to sort of validate what they're feeling. Dr. Sen, this is a question that came in during the webinar. We're heading into a gray winter. Is there special advice about how to manage seasonal affective disorder? And is light therapy actually useful?
Yes, it is. And I think for the specific case of seasonal affective disorder, but also I think in general, we probably don't use it enough, both in a sort of a natural way. Getting light, particularly in the morning, right after we wake up, is really important in maintaining and setting really good circadian rhythms to our day. But if that's not possible, then light boxes really work well, and there's a bunch of good ones available to get us through these bleak winters that we have here. I think, like all things, how much this affects us is different, and we're all different in how we react. But setting, using light and more broadly setting up our schedules and our patterns so that it's consistent. Dr. Vitale mentioned exercise, and that also helps with that. And if you can do it at the same time during the day, that's great. And again, staying consistent with sleep and social activities, but setting that routine and getting light and getting us through the winters is really important.
Yeah, thank you. I know we're getting close to the end of our time, so maybe I'm give you this question, look for like a little bit of a quicker response on this. The holiday seems to be a little bleaker this year with a new variant. Do you have any specific recommendations for bringing joy to this holiday season? Dr. Billick?
I think my thought is that you deserve joy, and you have to look for it and create the conditions for it, right? So maybe there's not a holiday hack. You can't force joy. You can't just say, okay, I've got grief, I've got loss, I'm going to avoid feeling those things and pour eggnog down my throat and feel great. That's probably not going to work. But acknowledge, sort of like Dr. Vitale was saying, acknowledging and feeling other feelings, I think, is important too. And also knowing that you deserve to feel joy and happiness as well. And one way to do that, I think Dr. Vitale was hitting on it, is to notice for yourself the things that tend to provoke those feelings for you and have in the past, and maybe adding a holiday twist. So for me, that might mean sitting down and really thinking with my family or loved ones, what are things that make me laugh really, really hard, and trying to make time for that in this holiday season. Maybe it's like throwing a baking party, a holiday baking party with, like where you have to fail, right? Like a holiday baking party failure. But yeah, it would be trying really hard to make time for those things this holiday season.
To our other panelists, thoughts on bringing joy to the season, Dr. Sen?
No, I want to try that holiday baking party failure thing. I think that's great advice, and I think figuring out what brings joy for you, and your children, your parents or older adults you're with, and prioritizing that, I think is important.
And Dr. Vitale?
I think one thing I'll add is that some of my patients, my older adult patients, seem to get a lot of joy out of volunteering. And I know the volunteering piece has, again, been curtailed a bit by COVID, but if there's a way to be able to, whether it's volunteering and whether it's sewing or knitting or volunteering in some way, safe way with COVID that can be engaged in, for some people, that this brings a bit of joy.
Yeah, again, one of the other really difficult things socially, because volunteerism has been shown to be very helpful for the health of particularly the well-being of older adults. And with COVID, a lot of those routines got halted. But the good news is a lot of things have become virtual or become safe or outdoor and small groups. So, whether it was making masks or it was tutoring kids or whatever range of things. So people who have maybe given up on some of their volunteer activities out of necessity, maybe to revisit those. That's a really great point. This is an interesting question, and I think this is something that has gone along with the pandemic. Are there any tips for dealing with how I react to what seem like bad behaviors out there? The pandemic seems to have brought out negative behaviors in people. Anyone want to take that one? Maybe Dr. Sen?
Concerned you associate me with bad behavior, but I think, yeah, definitely that's true. And we've seen it in different, I think, again, trying to have grace and understanding of people is important. I think a lot of us forgot how to interact with people during the time when we were very separated, and people are dealing with things, so many things in their lives that we, you don't know about when you run into them. So trying to understand and where they might be coming from and being forgiving, and I think is important, and hopefully we'll get back to better behaviors on planes and sporting events and just in our daily interactions.
Yeah, thank you.
I'll just add a little bit, just a thought. I listened to a wonderful geriatric palliative care podcast recently, and just heard Janet Bull talk about a way to reinvigorate yourself and think about avoiding burnout. And a lot of the bad behavior, I feel like, might be related to just people's stress levels. And so to counteract that with something positive, to have you in a better frame and maybe more forgiving frame of mind. She talks about gratitude journaling and thinking about writing down 3 things every day, or maybe doing it just for 2 weeks, 3 things you're grateful for or you have gratitude for. So, which has been shown to be very helpful in combating burnout and reinvigorating yourself. So,
yes, I attended a little group session on gratitude recently, and I found it really simple but really profound. Mm-hmm. The last question, and we're going to try to wrap up quickly on this one. We talked about joy. I'm going to a little different take on this. I'd like each of you to quickly give a piece of advice on how to find some peace during the holidays and beyond. Dr. Billick?
So same thing. Can't force peace or happiness, can only create conditions that are conducive to it. And my big advice for you on that one is let go of any holiday traditions that cause family tension. You don't need them.
Great. Dr. Sen?
Yes, that's great advice. And I think building on it, figuring out what the keys for peace and joy and better mood is for you. For some people, it's doing the exercising every day. Others, it's getting 8 hours of sleep. For some people, it's interacting as much with people as possible. For others, as little as possible. And so trying to understand what's important for you, your kids, your parents, and others, and then prioritizing that.
Finally, Dr. Vitale.
For me, I would suggest if you have older adults in your life who are not on technology, they may be or do not have access or don't know how to use a computer, picking up the phone, giving them a call, connecting with them, that will bring them joy, and then it will in turn bring you joy.
Great advice. Thank you, Drs. Billick, Sen, Vitale, for your thoughtful answers to the audience questions. Thank you to the audience for these great questions. This session's been really great. I'm glad we didn't talk about COVID this time, or at least, not focused on COVID. It's been really a great opportunity to really talk about positivity, reflect on how far we've come, and really thinking about the holidays, reframing the holidays. And again, thank you to the audience for joining us, and thank you for your engagement and interest and ongoing support of Michigan medicine throughout this time. You've asked great questions, and we've tried to get through as many of the questions as we could. We hope you found the session informative and that you learned some things that might apply to your lives. And as a reminder, there's a recording of this webinar. It'll be sent in a follow-up email. We'll try to also include some of the resources that have been mentioned during this past hour. All of those who registered will get that email. And in the spirit of giving season, we'll also include a giving link to support our Child and Family Trauma and Grief Clinic Fund, which enables us to innovate around care, services, and community outreach to children, adolescents, and families who have significant histories of trauma or facing trauma or bereavement. And this has really been a very, very important resource for so many. Our goal is to promote understanding and healing, and to provide the population with care that is individually tailored to their developmental, cultural, and other needs. And we hope you'll consider contributing to this effort as the faculty and staff at Michigan Medicine work harder than ever to provide outstanding care. And this monthly series will be taking a pause and coming back in the new year in a bit of a different format. Please visit the Well Aware website to stay informed on the series, and we'll send out information soon regarding future events. Please stay healthy, safe, happy holidays, and go blue.